There's certainly a buzz about fertility online these days. And for those of you pursuing your fertility journey, I'm confident it doesn't stop there. Fertility, or other people's fertility, or lack thereof, seems to be plastered all over the place. It's hard to get away from, and there's so much emotion surrounding it. And if you're someone who's trying to conceive, it can be completely all-consuming, and the devastation that comes when you get your period each month is overwhelming. Trust me, I get it. This is a story I hear in my office often. And not only is it one of the times we as women need the most support from our family and friends and our healthcare providers, but it's also, I think, one of the stages in our lives where we learn the most about our bodies and how things work. It's not until we become hyper aware and focused on these changes that we even take note of them. My name is Dr. Tiffany, and I am a naturopathic doctor and a member of the Vitamart educational team. And we have put together a series of videos on fertility during several steps of the process. Through this series, my goal is to help women understand the process, help get things on track, and optimize your foundations for fertility. Whether you're in the trenches now or thoughts of fertility are just on the horizon for you, there will be some info nuggets for you to learn about your body and what things mean. Stick with me for the first video in our series. Part 1, so you stopped hormonal birth control. Now what? How to reset your hormones, post-hormonal birth control, and what to expect. Parts 2 and 3 to follow will cover tracking your cycle and then properly supporting your cycle throughout the month to optimize chances of pregnancy. Okay, so whether it's a fertility thing for you or not, you've stopped your hormonal birth control. Knee-jerk reaction is, I should get my hormones tested, right? Well, actually, I wouldn't recommend this. It can take about 3 and up to 6 months for your body to completely clear these hormones and start relying just on your homegrown natural hormones. So getting blood work right away doesn't really tell us anything at all. Plus, it's often unnecessary for young cycling women to need to get their hormones checked at all. So there are a few things we can do to prep your body for coming off the hormones, whether it's an IUD or the pill. But my first piece of advice is don't jump into investigation mode. Now, like I said, it can take several months for your body to flush the hormones. And then typically once you resume sole production of hormones, things will start to come out that were hiding before. My experience tells me that it's not very often women start an IUD or the pill for birth control alone. Typically, there's either one big or several smaller other nagging issues that cause us to consider those types of treatment in the first place. For some women, that's acne. For some, that's irregular cycles. For some, it's unbearable cramps. And the fact is, yes, often these birth control interventions will help with these issues, but it's not correcting the underlying problem, just covering things up and creating a solution. And by no means am I knocking these interventions. They are necessary for some, and often they help with these big concerns. The reason I bring up the fact that there are often other reasons we start the birth control is because often, those issues that were there before come back. For example, if you had really wonky cycles before and you could never predict them when they were coming, and you started the hormonal birth control to become more regular, there was a reason those cycles were wonky. And the underlying causes are still there. Now, everyone's situation is a bit different. And in the second video of this series, I'm gonna talk about cycles and tracking cycles and what's normal and not normal and optimal and not optimal for fertility. So tune back in for that one later on. The other reason I'm bringing all of this up is because often the symptoms that can come about when discontinuing your birth control can be called side effects of stopping. But truthfully, these probably aren't side effects so much as a return of your old symptoms. Okay, so what will be the major changes, aside from symptoms with your period, that will happen when stopping hormonal birth control? Well, majorly, hormonal birth control stops ovulation. So normally, and ideally, when you stop the hormones, ovulation returns. This means you may experience ovulation pain mid-cycle, and you're also going to start to see changes to your cervical mucus. More on this stuff in the next video. Also, some women notice when they're on birth control that their libido or sex drive will decrease, and maybe they gain a bit of weight. So it's possible that on discontinuation of the hormones, your libido will bounce back and possible weight changes can occur too. Okay, so now for the nitty-gritty, the real reason you're all still listening to me. What can you actually do to make this process smooth for you? In my opinion, there are 2 key things we can do to support this process in every woman. And then depending on other factors, there would be add-on options to these. The fundamentals here are 1, restoring nutrient insufficiencies, and 2, supporting hormonal detoxification. 1. Your hormonal birth control can deplete a number of nutrients. So if you're not already supplementing to correct the deficiencies, you should absolutely start when you're planning to stop birth control. The big deficiencies here tend to be the B vitamins, B6 and B12 mainly, but also B2 and folic acid. And we also see depletion of vitamin C, zinc, and magnesium. Yes, you could do just a basic multivitamin, but I'm not a huge fan of multivitamins for people who are eating real food regularly. I would typically recommend a more specific B complex and magnesium supplements separately. The B complex supplements that are my go-tos are the NFH B complex SAP and the CANPREV bioactive B complex. There's also the Best Vitamin Best B6 complex, which is quite well tailored to this purpose of replenishing post-birth control. This one is available through the Vitamart website. As you know from our previous videos, one of my favorite magnesium supplements is the CANPREV Magnesium Bisglycinate. If you're not familiar with supplementing magnesium, check out our video on choosing the right one for you to avoid loose stools and belly cramps. You can also consider a zinc supplement, at least for a short time. Zinc can be tricky because the supplement can cause a lot of nausea. You have to make sure you take it with lots of food and start with a low dose so you don't make yourself too sick. Zinc picolinate is pretty well absorbed, so you can look for that. You can also search for any immune boosting formula, and that would be likely to have a decent dose of zinc in it, as well as a bit of vitamin C too. Fun fact, there is a test we can do in office called the zinc tally test. You take a little swig of the zinc tally solution and spit it out. If you taste a yucky metallic taste, you have sufficient zinc levels. And if you taste nothing, sort of like water, then it means you're deficient. Cool, right? The second thing I really feel every woman can benefit from when changing our hormonal intervention is supporting our body's natural methods of detox that typically handle both our hormones and any medications. Primarily here, I'm hinting at the liver, with some help from the digestive system. Our liver is responsible for taking in, breaking down, and sending out all the medications we take. This means it sorts out waste, and its function will dictate how much and how quickly a medication will act. So, when we think about hormonal interventions, which women are often on for years, if not decades at a time, we should think about supporting the liver. Not only because it's been handling that load for so long, but also to increase the speed at which these hormones are cleared from our body to get back to normal. Now, as I mentioned before, we need a bit of help from the digestive system. The liver is one of our body's detox methods, but really when we think about how waste is expelled, it's through our colon. So the other key piece to supporting this is avoiding constipation at all costs. Hormone waste is expelled in the stool versus some other things which are expelled through urine. So making sure you're having frequent and regular bowel movements is key to flushing out those external hormones before they get reabsorbed. So how do we do this? How exactly do we support the liver and digestion? Well, there are lots of herbs that can be used for this purpose. But before we get into that, I think we should talk about lifestyle interventions to help first. The biggest ways to support natural detox is hydration and healthy eating. Include lots of fiber and veggies to support regular bowel movements, and good ways to support the liver through food are lemon water and beets. The other fun way to remember things that support the liver is by this saying, everything bitter is good for the liver. So bitter greens such as fennel, arugula, kale, and dandelion, just to name a few, are ideal things to have on a daily basis. Now back to helpful herbs. Things like fennel and dandelion can also be taken therapeutically versus just in food form. Milk thistle is another great liver supporter, and one of my personal favorites, burdock root. We can do these as teas, tinctures, or supplements. A great blend you can try in capsule form is Liver Sap by NFH. There's also a product by Alpha Omega called Liver Flush, which contains most of these herbs. And there's a tincture by Orange Naturals called Liver Health you can try if you're up for the taste. NAC, or N-acetylcysteine, is another one of my personal favorites for liver support. And it can be extra helpful if you also experience sinus congestion or phlegm. You can do this on its own or in one of these liver blends, but generally you need a pretty big dose of NAC to serve this purpose. So you're looking at multiple capsules per day of any brand supplement. The other thing you can try is a castor oil pack over your liver. Castor oil is an amazing detoxer, relatively cheap and easy to use. With castor oil, a little bit goes a long way. Start with a tablespoon or less, and you can apply it directly on your skin or use an old piece of flannel or an old sheet to apply it. No matter how you choose to apply it, you can put it on your abdomen, right over your liver, which is on your right side just beneath your low ribs. The key thing to remember is castor oil will stain everything. So wear a yucky t-shirt and protect your sheets if you're wearing it to bed. You can leave the castor oil on overnight or just for a few hours while you watch TV. And you can do this a few times a week. So to summarize, when you're thinking about stopping or currently stopping hormonal birth control, don't bother testing your hormones right away. Support potential nutrient deficiencies and support your body's natural detox through liver support and proper bowel movements. There's other stuff we can do too if you're suffering from symptoms after the fact, so stay tuned. In our next video of this series, I'm going to talk about tracking cycles, what's normal and what's not, and how we apply all of this knowledge to optimizing your chances of conceiving. Thanks for watching. Again, I'm Dr. Tiffany Zugin, naturopathic doctor and member of the Vitamart educational team, and I look forward to seeing you all in the next video, all about tracking your cycle for success.